basically a lot more about the science of exosomes rather than just clinical studies. I have no conflicts of interest. And this is a review of over 160 articles that I have gone through, including books. Now, what is exosomes? They are part of the endosome system, and that's where they originate. And basically, the multivesicular bodies, they can form the exosomes, but they can also fuse with the liposomes and basically degrade themselves. And here you can see the, I believe this is you can see the exosomes that you can see them, they're coming out of the plasma of the cell. And you can see the liposome and the multivesicular bodies that can basically fuse either with the liposomes or they can fuse with the plasma membrane and become, use the intraluminal vesicles, which is basically become the exosomes. Exosomes biogenesis depends on the fusion of these multivesicular bodies. This is a complex process and it involves signaling, cytoskeletal proteins, metabolites, and nucleic acids. That's RNA and so on and so forth. Exosome biogenesis is mainly divided into two ways, okay? One is the transport of necessary endosome sorting complex, the ESCRT, that is dependent, you see in the first slide there, and then the independent pathway from the ESCRT that, so there's two different ways of, that they can happen. The sources of extracellular vesicular are saliva, the breast milk, the blood, and the urine. And then the exosomes are a subpopulation of extracellular vesicles. And they have to be separated from apoptotic bodies and microvesicles. So there is a process of separation. It's not like that you can just grab them, and there is a very important process, and there is a lot of difficulties, and this is where the problems come with exosomes, because the different isolation methods, like the centrifugation, the UC that we call it, and the AAC, and SCE, and the problem is that they can be damaged during that process, and they can be contaminated during that process. So a lot of these more kind of that offer the highest purity, the 99% purity, they're not very well researched. As you can see, the UC method only has 50% purity. So the method of isolation of exosomes is very important. Now, the exosomes facilitate cell-to-cell communication, and they can do it through a fusion with the multivesicular bodies, like we previously said, or they can now fuse with the plasma membrane, and you can see the A, and then, or they can kind of be taken up as a whole, as endocytosis, and this is communication processes, or they can be delivered in the cytosol. Now, the exosomes are a cocktail of long coding RNAs, which have to do with gene expression, and microRNAs also have to do with gene expression, and also with messenger RNA. The messenger RNA is basically giving the messages from the DNA to the cytoplasm to create the proteins. So they are involved in all of these protein production that are the communication aspect of our body, the alive part of our bodies, proteins. Proteins are the brains of our cells. So cell communication by extracellular vesicles, there are some known factors and some unknown aspects. And it's the unknown aspects that makes the kind of double-edged sword that I'm talking about, the endosome and exosomes. So they're wonderful, but they can be dangerous for them. So exosomes, they have been used as a drug delivery vesicle, and they have actually been used very, very successfully as vaccines. And the first was in 1996, the first time that they found, the exosome as a vaccine. And since then, they used it, for the recovery and the repair of different vital organs, and also even for COVID-19, for different, or to kind of deliver like a vaccination, against different antigens. They have also been used, like the previous speaker said, in rejuvenation, in scar removal, skin rejuvenation, hair growth, and pigmentation. But we have to be careful because all cells, including pigment cells, have excrete exosomes. So if the pigment cell excretes the exosomes, well, that's not a very good thing, is it? So again, it goes with the isolation and the contamination process that I spoke about earlier, and how important that is. So the lab that you're getting the exosomes is the most important thing. So exosomes have been implicated in cell-to-cell communication. They have a role in the spread of proteins and RNA because of the microRNAs and the long non-coding RNAs that they are involving. However, they have contributed in the development of several diseases as well. So the beneficial is the green part, and the damaging is the red part. So stem cell plasticity, immune response, and nervous system, they have wonderful results. However, they have enhanced viral spread, the neurodegeneration, and also tumor formation. So there is several investigators, like Lee et al. Found that it inhibited angiogenesis and cancer growth, so that was good for cancer patients, and also inhibited melanoma. However, other investigators have found that have increased the cancer spread, and they have negatively affected chemotherapy treatment by rebooting chemotherapeutic drugs, basically stopping the chemotherapy drugs from acting on the cancer. So exosomes carry the long non-coding RNAs, like we saw before, and the microRNAs, and these are involved in gene expression, and gene expression can be a double-edged sword. Why? Because certain genes can basically enhance illnesses and harmful mutations. And then, of course, you have the positive genes that can enhance a number of good things. Now, you've heard about telomerase, and there's creams with telomerase, a lot of marketing about telomerase. Well, there was a study with a mutation on the POD1 gene that basically regulates telomerase, increases telomerase, and these people had very long telomeres, and you would expect them to live longer. It was the opposite. As a matter of fact, they developed cancers and malignant and benign neoplasms. 5 of them had blood-related cancers, 8 had skin-related cancers, and 7 melanoma, thyroid cancers. And gene expression is beneficial to the young, but it's deleterious to the old. So as you can see, what you see here, the blue goes to the red when they're young, and that is a good thing. And the red goes to the blue. Basically, that's a reversed effect in the old. So what's good for the young is bad for the old in gene expression. So you cannot just take gene expression and say that's it, that's the answer. So exosomes have contributed in the development of several diseases. Why? Because of the cargo of proteins that they're carrying, that you don't know what they are, because we have not investigated all the proteins in the body. We don't know what they are yet. So there is a lot of unknowns, and this is what can cause the danger. So they have a therapeutic or a pathogenetic effect, depending on the immunity or on the level of inflammation. Why? Because remember, it can be good for the young, but very bad for the old, because of the gene expression that they enhance due to the microRNAs and the long non-coding RNAs. So there is emerging roles of exosomes in normal and pathological conditions. In tumor, they're very good for as vaccines, but they can also enhance tumors. In infections, they can stop the infection, but they can also enhance the infection. And stem cells, and the stem cells have their own problems in terms of proliferation and arrested differentiation. So there is several aspects to the exosomes. There is a good aspect and there is a bad aspect. Dr. Hyde and Mr. Jekyll, it's like a two-phased situation. So there is several applications. There are batch-to-batch inconsistencies in exosomes that we have to be careful about. Lack of standard isolation and purification methods. There is a risk of infections because of agent transmissions and antigen transmissions, and speeding that process, and effect of storage conditions on exosomes, biotopic effects, safety, incomplete and partial separation, and alloreactive and xenoreactive T-cell reactions and responses. So although exosomes therapy may serve as a new approach, it should be still investigated a lot more thoroughly, and we have to be a lot more careful than just kind of do it without any concern. They're not always 100% safe. We have to be careful about it, and more investigation on exosomes, on its biology and related techniques has to happen. And thank you very much. And this,